I call the health meeting to order at 12 minutes after 1, and we're going to have the invocation by Councilor Thornton.
Dear Heavenly Father, thank you for this beautiful day. Thank you for giving us the right to gather here to help our people and giving us the right to be on the council. And please help the administration come forward to improve our people's quality of life and quantity of life. In Jesus Christ's name we pray. Amen.
Amen. Ms. Shelley, will you do the roll call, please? Present.
Clay.
Present.
Bill England.
Here.
Jack Baker.
Here.
Joe Word.
Honey.
Julia Coates. Here. Jody Fishingham. Here. Meredith Braley. Here. Don Garvin. Hannah Gloria Jordan.
Present.
Frank Tarkus.
Present.
Chuck Huston Jr.
Here.
Ian Keener. Curtis Snell.
Here.
David Thornton.
Here.
David Walkenstead.
Here.
Kara Cowan Watts. We do have a quorum.
Thank you. Next is the approval of the minutes, and I'm sure everybody's had time to review them and read them, and I entertain a motion for their approval.
Make a motion to be approved.
Second.
Had a moved and a second. All in favor of approving the minutes, let it be known by saying aye. Aye. All opposed, same sign. The minutes are approved. Next, we have Mr. George Valuers with the Claremore Service Unit. He always gives us a good report, so we're ready for you.
Thank you, ma'am. Good afternoon. Copy of my report. Collections are up. Visits, outpatient visits are down just a little bit. One of the good things we've been watching is the newborns are starting to creep up just a little bit. Last month I hired a chief nurse executive. Her name's Kathy Hilbert. She came from St. John's, but she'd only been there about a year. Before that, she had worked for the last 6 years as the chief nurse executive for the Alaska Native Medical Center. So she brings a lot of experience. She brings some good things to the table. Any questions?
Councilor Fishingham?
I ask you, can you give us a rundown on the contract health up at Claremore and how it's going and how much you spent and how the system's working?
We think it's going well up there. Our weekly budget is about $192,000, roughly $192,000 a week. Most of that is spent on direct transfers, chemotherapy, fractures, immediate things that demand immediate attention. And if we've got any, whatever's left over, then we go down the list of severities, cardiac and things like that. I'd been told there were some questions out there from patients and things on the inconsistencies. One patient said, hey, they paid for this and they denied mine. So I started going through the committee after the docs go through, and I started going through what was approved and denied and making sure that we're consistent across the board so that if one knee replacement is denied, so's the other one on the other side and so forth. Trying to make sure we're consistent there.
Councilor Lay?
Thank you. George, the contract health, are you utilizing an outside firm for that now, or is that in-house personnel?
We do that in-house.
Okay.
Well, let me back up. We take care of the referrals and the approvals and denials in-house, but it's actually paid, and it's handled through a fiscal intermediary. The actual payments that are made.
You've got is it a contract firm?
Yes. And that's all handled through the area. It's an area-wide fiscal intermediary.
Thank you.
Yes, sir.
Any other questions? Okay, thank you for that good report.
Thank you.
Next is Connie Davis with our Cherokee Nation Health Services.
Good afternoon. Any questions about the month's report?
Councilor Hoskin.
Thank you, Madam Chair. Yeah, I appreciate you noting in your report the healthcare law that passed. I did have a question. Is my understanding the Supreme Court struck down the provision that requires states to expand Medicaid, which of course is a big deal. And the expansion of Medicaid shows up in your report. Does your report assume the state of Oklahoma is going to expand Medicaid, or will we benefit from some Medicaid expansion even if Mary Fallin follows some of the extreme right-wing Republican governors and says, no, we're not going to expand Medicaid for some of our poor citizens. We're going to leave them to fend for themselves.
We are actively involved in tribal committees that are meeting across the nation. And we just returned from a short trip to Denver this past week where we had that venue, and I think over 60 tribes were represented there. And we got to speak directly to CMS representatives about our concerns. I think, obviously, the Medicaid expansion would benefit us greatly. The numbers that they described to us was that currently there are about 25% of the population, Native American population, that's not covered by Medicaid, and with the new incentives, if you will, or the new program, would expand that coverage to about 47% for Cherokee Nation. So we're optimistic that that will be implemented.
But that assumes that the governor of the state of Oklahoma wants it to be implemented.
Yes.
Correct.
Yes.
And so that, and this isn't in your area, but we're talking about donating the candidates running for state legislature and supporting the governor, lobbying the governor. We ought to know what these candidates, how these candidates feel about Medicaid expansion, because if they're against it, which so many of them are on record publicly of saying they're against it, what that really means is they're against third-party collections that we could get to benefit our system. They're against most of our poorest citizens who would benefit from it. So I hope that we're mindful of that, and I hope we're lobbying the governor hard not to follow in the footsteps of some of these Republican governors across the country that have said, by God, we're not going to expand it. So we got to keep an eye on that, otherwise we're not going to see any of these benefits.
And I think our latest estimates are that we have 60% of the people we serve have some sort of third-party payer source. So even if we could get a fraction of that with this Medicaid expansion, it would be a tremendous impact to our financial stability here at the tribe.
Will there come a time when we can estimate what that number will be? I mean, could we say, here's our population, here's the numbers that already have a third-party payer, but here is the number that it would go up if Medicaid would expand in the state of Oklahoma? Is there going to be a time when we can get a handle on those numbers?
Boy, there's going to have to be some way to predict that, but as far as health, we don't know the income of the families, and it's based on income, of course, so it would be difficult for us. It would be purely speculation at this point.
Okay, thank you. Thank you.
Next is Councilor Keener.
Thank you, Madam Chair. My questions are a little bit similar to Councilperson Hoskin. You said you were, in the course of that conversation, said you were optimistic.
Means I'm praying every day. And I have a lot of faith.
Governor Fallon's already rejected the $54 million grant, so
Yeah.
that doesn't give me a lot of optimism. But I mean, I would like to remain optimistic as well for our people.
I think the tribes are going to be heard. I mean, we have a strong voice, and the president seems to support that with the Indian Healthcare Improvement Act. I'm not stating that correctly right now, and I was just reading some more last night. But I think, I don't know how they can turn it away right now. We've got to do something, because it's not going to fix the problem. You know?
And you say you want to develop comprehensive plans to work with the state and federal level. So do you have any ideas on that yet? How are you going to do that?
No, you could go to a meeting every week for consultation, and we're just trying to put the right people at the right tables. Dr. Grimm is a highly respected source for us here at Cherokee Nation, and he's helping us with that. But I can't answer you specifically right
Okay.
now.
Well, one thing, you're going to have an advisory group. I assume
Yes.
that's underway right now.
We're coordinating that right now, and we want to work with the other tribes locally so that we're on the same page.
And they could be going to those meetings every week for consultation, correct?
Oh, they were. There were some. I think all the local 5 tribes were represented in the meeting this week as well.
That they can keep going and
Oh, yes.
reporting to you
Oh,
and
yes.
report to us?
Yes.
Okay. I guess at this time there'll be all the questions I have to ask, but I appreciate the thoroughness of your report. Some good reading.
It's overwhelming at best, and you're still just waiting to see what direction somebody's going to decide to go.
And I would ask you to stick around for a little bit for another business item
Okay.
on down as far as home health,
Oh,
if you don't mind staying. for that.
absolutely.
Thank you. Thank you, Madam Chair.
Thank you. Next is Councilor Byrd.
Connie, would you make this a priority item at the next intertribal?
Yes,
I think the intertribal is up next month.
I believe so.
Yeah, to make that a priority because that is an issue that we're going to have to address. Elections about 80 days away, presidential,
It is.
85 to be exact, and this is something that really needs to be a priority for the tribe. Thank you.
Absolutely.
Thank you, Madam Chair.
Councilor Fishenhawk.
Connie, what did we found out about the phone refills? I asked you about them last month. I think
I didn't hear.
the phone refills, the automatic phone refills.
Well, I don't feel like a lot of people like that phone refill system, and I know Jeff has done some work on that this week. We've got a task force working aggressively with that, and we currently, I think I discussed with you earlier, we encounter challenges with that working well.
I know y'all's working on it, but we've mentioned it 2 or 3 months in a row. So what have you done since we first started mentioning it?
We've got a special
We formed a
team
committee.
coordinated, and they've met twice, if you don't mind. Yeah.
Would you please?
Yes.
Afternoon, everybody.
Thank you, Jeff.
I think with Audio Care, which is the newly implemented refill phoning system for 4 remaining sites we've had, really, I think there's 3 big issues right now. Number 1 is the use of Social Security numbers. I know we have a lot of concerns. Identity theft is just prevalent in our society. We've all seen what happens when people lose their identity or it gets stolen. So what we've done, we've contacted Audio Care, and we're in the process of having them allow us to use chart numbers. Now, with the chart numbers, we're also going to have to request a birth date because we do have duplicate chart numbers in our system. So that will be the verification. And at this point, it's still early and they're developing the programming. I'm not sure if it's going to be requested of all patients or if that chart number will only be needed when the system recognizes a duplicate chart number. The second thing, and I've called the system myself, that I think is customer unfriendly, was the fact when you're into Audio Care, you have no option to talk to a live person. That's the other thing we're going to add to that system is an option, if it's hit 0 and talk to a pharmacist or a pharmacy staff member, which, allows someone who has difficulty using the system to actually give those orders to a live person. And that is still an option if they call the pharmacy itself. Then the other thing that we found out now we can do is individualize a message per site that will go back to each site being able to tell its own message. When patients pick up the phone and use the Audio Care, they're going to hear that site's message. Hastings parameters were a little different at pickup than what we had at Wilma P. or Muskogee or even Salina. So once again, we'll be able to individualize and tailor the system back to the patients. I will say that what I don't really want to do, and we are looking at other systems, we have a couple of people actually at Hastings who have championed this, and they're looking at some other systems as well and options for our patients. But what I really don't want to do is go back to a voice message retrieval system where they just phone in and leave their prescriptions. And it actually takes just as long or longer for someone to leave all their information on a voicemail than actually punching it in. But it also makes the processing time quite a bit longer for the pharmacy staff whenever it's time for them to pull that order and view it. And the hardest thing I think for us to get around, but it's gotten a lot better over the years, is when you want to pick up the phone and say, just refill all my meds. And that makes it really difficult for pharmacy staff and patients, because I'll be honest, there's a lot of unexpected occurrences when you go up to the window and you go through your bag of meds or you get it in the mail and, well, I didn't get this and I didn't get that. And that's the beauty, I think, of audio care, is it actually tells you when they phone in whether it's refillable, if it's too soon, or if it's possibly on hold when the pharmacist has to review it before it's released. And I think with those first 3 fixes, we'll hopefully address a lot of the concerns that we've had with the system. You guys have specific questions?
I'll let you know something in a month if I'm still getting home.
Okay. And honestly, I wish I knew how quickly we could get this taken care of, but part of this is in the hands of Audio Care's programming department. And so, we're pushing them to do it as quickly as possible. But I honestly don't know how long it's going to take them. Personally, I thought
Sometimes
maybe a
I feel like if I
couple
give them
weeks.
you all's number, it might get fixed a little faster.
If I was, yeah. I'm getting a few emails, but please feel free to email me or call me. I mean, I'm more than happy to help out. And it gives me more information to actually follow up for other needs as well.
Okay, thank you.
Sure.
I've got a comment before you sit down.
Sure.
It seems like we initiated that quite early down at Redbird. Everybody's just about to get used to it, but I still do get a few calls. But I use it myself, and it's not user-friendly. It's not very plain at the end that everything...
That's your order's completed.
Right.
That is another parameter we're also correcting as well. At least it will tell you, or should tell you, that, are you done? Press 1 to exit, or 0 to talk to a pharmacy staff member. Yeah, that was another issue that came up as well.
Well, if everything is in order, it goes good. But a lot of times people call it, and it will say, there is a hold on that prescription, or this one may take 10 days, instead of like usually it says, you'll get it within 5 days. And I will say that I know a lot of people that use it. Generally speaking, we call it in on one day, we get it the next. It seems to be working much better than it did. I'm not getting as many complaints and calls, but when I do, I will say that Jeff has been really good to resolve the problem. I get people from all areas, not just Sequoia County, that call. But I think it's getting better, but it's not very self-explanatory.
No, and I agree. That's what I say. Even when I call it myself, there's some user-friendly parameters. And if we're going to mimic, which the system is basically a retail-driven system, if we're going to mimic that system, I think we need to give our patients the same options that they have when you call a retail pharmacy too, to be a little bit more user-friendly. Yeah. Thank you very much.
All right, thank you.
I got another question for you. You was talking in here last month about developing a brochure or video for contract health.
Yes, we are. There's still, I've submitted that to some of the management at the complex for their comments, and just to be honest with you, we felt like there was just too much information on that one, so we're revisiting that and trying to condense it down to where it's more bulleted. There's just so many variables, as you know, depending on where you live for contract health, and trying to get all that information on one brochure.
Well, instead of, and it's a good idea, don't get me wrong, I ain't saying don't do it or I'm against it, but have you all considered, instead of just making brochures and videos, perhaps making the contract health system easier?
Yes. You'll have you to know I have another committee for that one. But we are actually working on a process to do those things as well. We would like to implement a process in the clinic when you get a referral from your provider that you go and meet with someone from Contract Health that goes through and verifies where your address is and see if that's going to be an issue with payment, and helps facilitate that appointment as much as we can at that time. And just last week, I believe, we began expediting the approval process in that we're reviewing those referrals daily rather than on a weekly basis now.
If something is so complicated, we can't get it on a brochure, I dare say it's not, it may be a process.
Oh, no, you're absolutely right.
Okay, the other thing is, I talked to you before about, I don't know if you call it second party or not, like I had an elderly person who in there, they had insurance, plus they had, I guess, Medicare, and nobody even asked anything about it to bill Medicare. And I'd like to see how the Medicare payments, which, like I said, maybe I'm calling the second party, I'm quite sure what we call them. Could you give me the numbers for them to see?
Like secondary insurance? Okay.
Because they said there wasn't even, and the other thing is, a bunch of us has got complaints, and it's on streaming video, so I hope every one of your employees is listening to it, about people being jumped onto, called into, saying, don't talk to council, let us handle it. What are you going to do about that?
Well, I met with my first staff group at Hastings this last Friday and cleared the demands of the chief, that you guys are available, available to them as a representative, as a tribal council member, and they should not be punished or condemned, and certainly no retaliation on employees who come to you guys for guidance or to express concern over whatever it may be. So that's our message, if it answers your question.
Okay, have you, like Three Rivers, this didn't have anything to do with Hastings. Three Rivers here a while back. I happened to be over there the day air conditioning went out. Wasn't nobody told me I was sitting in the chair. It was hot. Some of them people called me, you'd already got on, somebody had already had words with them. Who told the counselor, Connie got a call, all this. What have you done about the other clinics versus Hastings?
Sent the same message to that person, to the leadership there at that clinic.
Do you know if they disseminated it out to the employees? Can you send an email
I
as Director
certainly
of
can.
Health to every health employee on?
I can.
Okay.
And I will
would
copy
appreciate
you guys on that as well.
Okay, I appreciate it very much.
You bet.
Councilor Garvin is next.
Thank you, Madam Chair. I just want to thank you for helping over at the Three Rivers on the air conditioning. We had one that kind of got tired and wasn't putting down any cool air, and I think George Long helped, and Rhonda Cochran and others. Pass the word on. We really appreciate it. And it's getting kind of hot. I think it's around 114, 112. This part of the clinic was affected, but those that were, it really was getting hot. I think we just get a little bit tired and need a little refurbishing or something. Thanks a million, we
Well,
appreciate
you're
it.
very welcome. It was a tough summer. Some of it really exhausted the efforts of a lot of our air conditioning units. And as a note, I did have a report from Jennifer Scoggins in Salisaw, and the chief was there to visit with the staff and patients as well this morning. And they're all up and running, trying to see patients as scheduled at that clinic. So Rhonda Cochran and Jennifer Scoggins and Dr. Brandy Duke are really to be commended for taking such a mess and physically relocating their staff and equipment in a matter of a few days to the annex building. So kudos to them.
Well, Councilor Thornton and I both want to thank you and Dr. Montgomery and everybody that came down. We had an emergency meeting down there last Tuesday with the staff. I thought everybody did a great job explaining to them we were in real no immediate danger and kind of calmed everybody's nerves. But we got an excessive amount of calls from elderly constituents, not just elderly, all kinds of people, worried because they thought they were just going to be closed and shut out in the dark, and everybody gets real attached to their health care provider, and it just made some of them sick. I mean, they just can't do without these different people that take care of them. They really like their physicians and nurse practitioners, but I think it's working out. But it may not seem big to you other people that's on the council, but when it happens to your clinic, it's a big deal. I mean, when it was just like a shock wave throughout Sequoia County that, oh, the clinic is closed. I heard it, and the people call me late at night and early in the morning, but I'm sure.
Can't afford to go to Steelwood.
Right.
Can't afford to go to
Oh, I got calls.
But we really do appreciate it. So I think the next person to speak is Councilor Light.
Thank you, ma'am. Connie, that report about the contract health deferral system between Claremore and us, is that working up to speed now, or?
Well, to be perfectly honest, I don't know what your idea of up to speed is, but we have a lot of resources that aren't being utilized. And I think we have a meeting after this one to look at what we're doing with that and how to maybe expand the opportunities to use those funds. Because it's hard for me to stand up here as your health director and say we've got this money and we're not using it, and we have unmet patient needs throughout the service area. So we're going to look at some ways to bring back for consideration to make sure we can use those funds.
Are we getting the information we need from Claremore for that?
Well, I'll have to defer to Brett for that, but I think you're seeing about 60 referrals a week from Claremore. But we want to work with Mr. Valier and his staff, and if there's something we can do more collaboratively, we're willing to do it.
so I don't hear an answer. Do you think it's working properly or not?
I think it's working. I think it could be better. I think that's my answer. I think there's more opportunity there because I think the focus of the policy maybe needs to be expanded.
These approved, pending, denied contract health cases, do we know that those pending are actually getting worked through here? I've asked.
Yes. Part of the problem with this is that report goes in about 3 weeks before this meeting, but since I received your email, I have spoken to Brett, and we're going to try to reformat that reporting system even more so that people who are deferred, you know in the next month of those deferrals how many were approved. Yes.
Thank you, Mickey.
Counselor Walkenstick?
Hey, Connie. Well, first, I just want to appreciate your administration meeting with the staff to get the needs in the hospital. I think that was big. Some of the staff at the hospital, they said that they're needing more gyroscopes. They said you probably heard that in the needs deal, and they said they may have one there, and I guess we have money to buy those, correct?
We do. We have an equipment fund, and we have capacity there.
Okay. As they said, I guess it was turned down, I guess, a few months ago by Mr. Thornburg.
I don't know about that for sure, but I can tell you that I met with some of the staff from the OR on Friday to address several concerns that have been streamlined through Mr. Lay that he had brought to my attention. And I sent about a list of about 20 items to the leadership there, as well as the physician leadership, the chief of surgery, chief of OB, and the medical director, Dr. Nolan, to address those things.
Okay. And have we had a schedule put in place for the surgery nurses to relieve them of some hours? From what I've been hearing is that they feel like it's like some are working 24 hours. They're on call for they're at work 16, then they're on call for so many hours, and it seems pretty strenuous. Wanted to know if you guys thought about hiring extra help, or is that something that you guys are looking at doing, or?
Yes, we identified several opportunities, if you will, to do things a little better, including changing their schedules up so they, are scheduled late if we have cases running late. There are a lot of things we can do to make it a lot easier.
Yeah.
But I will tell you, in a study that we did as far as nurses taking call, nursing specifically, they were on call about 12 days every 3 months, which is pretty minimal compared to other institutions.
Uh-huh.
But it doesn't mean that when you're working 16 or 24 hours, you need a break between going back to work to do a surgical case the
And
next
how much
day.
they're getting paid? What, $1.25 per hour?
Be on call.
To be on call.
Mhm.
What's the government rates to be on call?
Oh, they're all over the board.
Are they?
I mean, the IPAs get a 25% bump to their base to be on call. It's huge.
So we're being somewhat competitive, I guess.
No, I wouldn't feel like that would be a competitive.
Really? Okay.
To be perfectly honest, I don't think it's.
Good deal. Well, again, I appreciate you guys instilling a sense of security and safety within your staff to get the open door policy so they can address the needs of what they see firsthand in the hospital, so that we can, better the life for Cherokees.
Well, good. That's how we want it to be. We want people to feel good about their environment, and they all have my personal cell phone now, so.
Do that good.
I gave out my card.
All right. Well, Connie, I appreciate you.
Thank you.
Okay. Thank you.
Okay, thank you. Counselor Fishenhawk?
I want to bring something up. Jay and Wilma Key talked to me when we were out on the board with Curtis. Is very concerned about Jay.
Okay, what I have learned about Jay is it's going to build a new clinic will be about $17 million. And we physically own about 8 acres there behind the clinic that we have, and we need 10. So we're going to look. Jody was kind enough to share. She knew an option for us to maybe look at in the community, and so that's the direction I got, or the information I got back last week. So we're looking for some land in Jay. If you know something, let us know.
Wilma P.
Wilma P is going to be about $5 or $6 million to expand, and think, I don't have that with me, that was to expand another 10 or 12,000.
12,000?
I think so. And we do have property to do that there.
Okay. 12,000. Oh, 5 or
So
6 maybe.
if we can keep our other clinics from being compromised with air conditioning and other issues that cause it to shut down, we can get focused on expanding and rebuilding in our other areas.
Okay. And then the other thing is, I know you've got some reports to give to the council on some information I wanted for the clinics that you brought in today. Along with that, could you please, and I'd like to know by departments, because I know like up at Hastings, we don't have endocrinologists. I know we don't have orthopedics, different areas. So I'd kind of like, I don't know, maybe a graph or a chart or something that shows me how many providers we got in each department and where we're lacking, what the caseload's being seen. That wasn't in that report. Could you get that broke down for us?
Yes, we're working on that because we've met with HR and all our budget. You know, we want to do a modification to the provider salary, but that's based on budgeted positions. That's not even based on need, you know. So that's why I said, let's just do it right. Let's get it based on what we really need to meet the needs of the patient.
I have never seen that we are not based, when I found out we do not based on needs. Yeah,
I know.
that's totally true.
But we're going to get there. It just takes a lot of time. But
Okay, thank you.
yeah.
Counselor Thornton, you're next.
Thank you. I just kind of wanted to echo what Ms. Janelle echoed Fulbright here come up with, and thank you for the reaction that you had there. It was very quick and speedy and to the point, and I think you really performed well there. So did the doctors. And but there's something else I want to talk to you about, and it comes up all the time. With the last director, it came up. And so I got different answers. But I'd like to know what the 30-day prescription versus the 60 and 90-day prescription. How come we can't go to the 60 and 90-day? And can you maybe elaborate that
I can some, and then
in the email and send it to me?
yes,
Okay,
slide to you.
that's what I mean.
Actually, it'll be coming from Jeff Sanders
Okay.
because he's working on that for us as well.
Oh, looks like it. Thank you.
Counselor Hoskin.
Yeah, just briefly, Madam Chairman, back to the 5%. Am I correct that if you are denied or deferred at Claremore, information automatically goes to our contract health to consider the 5%? Is that correct?
We've asked that if it was going to be deferred, they automatically deny it so that we can expedite it coming over to our CHS system.
So there should never be a situation, assuming things work perfect, and I know they don't always work perfect, but if that works the way it should, there should never be a situation where someone is denied at Claremore and then they don't hear anything from us on what happened with the 5%. That should never happen. If it's working smoothly, mindful that we're early on in this policy,
Yes.
things don't always work smoothly.
Yes.
If, for whatever reason, the patient would be denied for the 5%, will they get something in writing saying that they've been denied so that they will know they were considered? So if they call me, I'll say you were considered and you got that letter saying, will that happen? Okay.
Yes.
Okay, thank you. Thank you.
Okay. Counselor Snell?
You talked about 8 acres. You're talking about across from the clinic, across the street from the existing clinic?
My understanding is that it's behind the clinic.
We went and looked at property there, and there's not enough property there, period, I don't think. It's a narrow strip. It's not. And if we close the clinic, it goes back to J. Goes back to City of J, so we can't use that property there. But anyway, we was looking at different properties out at the industrial park. Our food distribution center. But anyway, that's a long situation, so we'll just look at the property and get back with you when we take a report to you.
The 17 million quote was to build a 40,000 square foot facility. We currently, with the public health nursing and the houses that are there close to the clinic, have about 28,000 from what I understand. So that would be a pretty significant increase.
Yes. Okay, thank you. We'll get back to you.
Counselor Walkenstick, you're next.
Oh, Connie,
Yes.
I've got one thing on this. The C-section. If there was an emergency C-section that needed to take place, would we have someone at Hastings to be able to accommodate that?
Yes.
Okay. Yeah, that's all. Thank you.
Looks like we've covered everybody except myself, so I've got some questions. Oh, yeah, go
Ms.
ahead.
Fraley hasn't had anything to ask.
I just wanted to call everybody's attention. Oh,
I'm
Go
sorry.
ahead.
go ahead. No, I just wanted to call everyone's attention that in District 4, the customer satisfaction rate is 95 and 93%. In Salina, it's 95, and Benita, it's 93.
I'm still trying to steal your doctor.
And in Stillwell, it is.
Once we take him.
Madam Speaker, you.
Yes, Connie, I just forgot to ask you earlier, are we advertising for any housekeeping people at the present time?
I believe we've hired, are you talking specific to Hastings?
Yes,
And
yes, I'm
on an
sorry.
issue that we're addressing there, and we have hired 3 new housekeepers there.
Do we need some more?
I don't know that we need more at this point, based on my advisement from the leadership there in their housekeeping department.
So that will, during the day, if we have problems, they'll be there and can take care of those situations.
A lot of it is just the sheer volume of people physically located in that building at one time, and, you know, high traffic areas like the emergency department, we're trying to focus some efforts there.
And you didn't steal them from the complex, did you?
No, we took them from Wilma P.
I am not surprised.
Thank you very much.
We'll have the 3 new additional people begin work yet.
I didn't understand.
Have the 3 new additional housekeepers begin their duties yet?
I would have to check with HR to find out. That was about 2 or 3 weeks ago, so we should be close, if not.
I've been over there several times this past week. So,
We need help.
badly in the ladies' room. Okay, I guess I'm down to myself, and I want to inquire about how we're coming along with getting mammograms at the clinic down at Redbird, because we had discussed that previously.
You will be happy to know that that quote was placed on my desk last week. I haven't read it, but we do have a quote, so that's a starting place.
Right. And I have one other question. This new money that we appropriated for the $5 million, part of it was to go for dentures, eyeglasses, hearing aids. And I've talked to the hearing aid doctor several times. He said he's heard nothing of that. Everybody that comes in that gets a hearing aid, they give them one, you know, if they need it. But he said majority of the people need a second one, and they have to pay for it themselves, and that's another $275, and a majority of them don't have it, so therefore they just get the one. Is any of that additional money being funneled into that?
For a second hearing aid, I don't think so, but that's something we can add to our list of things for consideration.
Another thing, I spent a lot of time over there in the emergency room with a family member, and I have nothing but praise. They saw the triage nurse in 8 minutes. They saw Dr. Franklin within 15 minutes. He spent a lot of time, and I just thought the service couldn't have been better, because I've had a lot of experience with the hospitals in Fort Smith and their waiting rooms. So they didn't know me or who I had with me. We were just like the average person that walked in, and I thought the service was wonderful. And I said, you know, I get a lot of complaints about the emergency room, but maybe we just hit it lucky. There was only one other person there besides us, and maybe it was too hot for people to be out. I just don't know. But we really got great service. We couldn't have had a better doctor. So
Yeah, Dr. Franklin is very good.
very good. Any other questions? Everybody's got lots of concerns about health, and that's one of the biggest things we spend our budget on, because it's very important to our people that they do get top-notch health care, and I think it's very good. Councilman Byrd.
Speaking of health, I try to detour people more to our wellness center,
I know you do.
Marcoma versus Hastings. I figure the more I can get up there, the less we'll change to Hastings. But they're asking for a better road. That road there's kind of difficult.
That's what I hear, and had the same concern when I managed to get there early in the morning.
Okay.
But I think we have some opportunity with some funds to help get a paved road back there.
Thank you.
Councilman
Thank you,
Byrd,
ma'am.
I hate to respond to you this way,
Okay.
but we would all just be tickled to death if we had a health wellness center, something like that in our counties, and we wouldn't care if it had a gravel road. So you're just blessed if you live in this area,
Yeah.
because
It's
you can walk around the track at the Redbird Smith
Yeah.
Clinic. Other than that, you're out in the cold.
Yeah, I
Bunch of
know.
hearings are coming up now.
Yeah, and it's a bad deal that this is the capital of Cherokee Nation here in Tahlequah. I don't know who created that.
I don't know. It is a wonderful facility, but
Yeah.
we'd like it to be spread around. So,
Yeah, thank you.
is there anything else for Ms. Davis? Okay, thank you. We do appreciate you. And I want to take a point of personal privilege and introduce my cousin who is here today. Please stand up. Yvonne Garvin Nance. She has a home down at Miller Ridge by me, and she also lives in Claremore. So I guess you'd say she's got a lady of luxury with a summer home and a winter home. So. Blevins now.
You don't have walking stick introduced?
I apologize, Yvonne.
well, Brent Taylor's here.
Pardon?
Well, Brent Taylor.
Oh, one of our CMB board members, Brent Taylor. Where are you?
Hey. I'm disappearing with you. Sorry.
He's not here.
Are you pulling a joke on us again, like Dr. Montgomery when you introduced him?
That was from last month. We had Dr. Montgomery, but it's Brent Taylor, a.k.a. I'm joking. You guys remember that?
Yes, we do. Okay, next we go down to old business, and Councilor Fish and Hogg has for discussion comparison of healthcare providers' salaries. She spent a lot of time and effort on this. We were all delivered a booklet about this a couple of months ago, and I don't know if everybody's examined it as well as she has, but she's going to give us a little summary of what she's found out, and maybe we can order a work group and meet trying to... Go ahead, Councilor Fish and
That
Hogg.
would be great, because we always run short in here, and I really would like to form a work group, because when I started asking questions about some of the doctors and specialties we have, we don't have them. And then when you start looking at what we pay them compared to what they're making out in the real world, some of them's making not even half of what they would make if they was out working somewhere. And we're not going to get providers. You know, everybody in here knows I've got a sister working up at up at Hastings. But I look at what she was paid plus what she was offered to go to Colorado this past week. They sent her an offer. And Colorado was more than doubling her pay. And we all know what doctors make. Some of them might come out with, $500,000 in debt. I think that's going to be some problems we're having, and that's why people like her will not stay. They're young, they want to get, that's when they earn their money. And I'd like you to suggest a work group, because just like Connie said, when we started looking at this, it was not based on needs, folks, and healthcare system has to be based on needs. It can't be on a budget.
Well, I did see in the report what looked like our anesthesiologist and our OBGYN doctors were paid a lot more than some of the others. And as you say, I couldn't figure out any rhyme or reason, so I figured somebody smarter than me figured this all out. But I'll ask for volunteers who would like to be on a work group to analyze all this. And those of you who lost your booklet, we might could get you another one. So. So just contact me if you want to be on a work group, and we'll set up the time to study this more at length. And then we'll report back to the administration with some recommendations. Whether they relish getting them or not, I do not know, but we'll have our input into it. So we're not really tabling this, we're just going to have a work group and talk about it again. And new business, Councilor Lay, would you like to take that as a resolution?
Yes, ma'am. A resolution authorizing the Cherokee Nation Health Services to assume management, supervision, and oversight of the Cherokee Nation Home Health Agency and hospice of the Cherokees, and I'd like to make a motion for its approval.
Yes.
I'd like to be added as a sponsor.
You want to be added as a sponsor? Anybody else would like to be added as a sponsor? Frankie and Chuck Hoskins, Councilor Kurtz. Okay, we've had a motion and a second, and now we can discuss it. It's open for discussion. Anybody got anything they'd like to comment or say about it? Yes, Councilor Keener.
Thank you, Madam Chair. Connie, if you would mind coming back, please. In your efficient report, we've got a profit and loss by class section. So I was just going to ask you what the impact on the, maybe not will be this year, I guess, but next year's budget will be. Are we starting off with 463,000 in the hole?
According to that report, I don't want to speculate an opinion on that. I would like to have an outsider firm come in and audit the financials of these businesses and give us some recommendations based on their findings.
Okay, so we're not ready to vote on this then?
No, just but in concern to your question, if we're 400,000 in the hole, I want to validate those numbers is what I'm saying.
Okay.
Maybe I'm not understanding you.
Well, it looks like we're going to vote to,
Yes.
so we don't know where we'll be when we start. Is that, unless we go by these numbers.
Right.
Yes. Yeah. What impact will it have?
Oh, okay. It's really asked, but what would be the impact to health?
Yeah.
These should be financially viable businesses. They should be able to support themselves without any funding from health.
Well, but I see a negative column here, 463 and a negative 53,000.
I think that was why they wanted it moved under health.
I understand that, but I didn't know what the plan was on moving forward.
We will bring, like I said, we will get an auditor in here. We'll get a leader in there to help us give some better recommendations on how to make this a revenue generator rather than a financial burden to health.
And will this be a part of this next year's budget? For the 463 and the 53,000?
No, it should not impact the health budget at all. This is a business. It doesn't come out of health dollars. So that budget's not even considered in the health budget.
And so we'll just oversee it
Yes.
starting when this is passed?
Yes, and we'll continue to send you these reports so that you can see how well we're doing or how well we're not doing.
Thank you. Thank you, Madam Chair.
Councilor Fisher-Hall.
First off, I'd like to add to this, and Connie, I would really appreciate a new set of eyes on this. You're in the health field, I've been there. We're the only people I know where this department is that cannot make money in home health. You know, it blows my mind we can't. There's major problems over there if there's no money to be made, and we're actually in the hole because these profit margins, these percentages run really high. I would like to be added on there, and when you pick something out and you get a report, could you let us know?
I'd be happy to.
Thank you very much.
Any other questions or concerns? Councilor Freddie?
I don't know who's heading this up, but if this is moved under health services, will all the same benefits, IDC and fringes, will they be imposed on health services program?
No,
Since
because
it'll be
it's set
under
up as
management?
its own business entity. It shouldn't be imposed on health.
Okay.
Because it's a business and they're not employed by Cherokee Nation.
But you're gonna have to pick up some costs somewhere. You're gonna have to- are you gonna
Probably
have-
administrative costs is all.
Okay.
But even part of that should be able to be sustained and paid through that as a business expense.
Medicaid has been cut to this program considerably, I understand. And if so, will you absorb that lack of revenue?
Well, what you find out is it comes to the hard decision of accepting patients with payer sources or not. And we'll have to look at opportunities to take care of those patients without a third-party payer.
But you don't have any idea what that impact might be based on?
No.
Okay.
We have any more discussion on this? Okay, yes, we're ready to vote. All those in favor of us taking over the home health and elder care, will let it be known by saying aye.
Aye.
All opposed, same sign.
Aye.
One opposed. Motion carried. The next meeting is tentatively scheduled for Monday, September the 10th, and I entertain a motion for adjournment. Motion is seconded. All in favor of adjournment, say aye. Aye. Meeting is adjourned.